Surgery live from Deuk Spine Institute Surgery Center Vieira. Our patient has a herniated disc in her neck. It is at C5-C6, the most common disc to herniate and cause symptoms. Her symptoms are neck pain going into the shoulder and down the arm with numbness and tingling in the left side. We're going to approach it from the right. The first thing I'm doing, the patient is asleep. They are completely chemically paralyzed, so all the muscles in their neck are relaxed. And my anesthesiologist is holding the head in slight extension. Slight extension. There you go. And I'm pushing the trachea and esophagus over, and I'm going to palpate the spine. I feel it. I'm right on the anterior ligament. Shot. I'm going to use my lateral x-ray. I'm a little too low. You agree, Luis? I'm going to creep up just a little bit to 5-6. Shot. 2, 3, 4, 5, 6. You need to be a little bit higher right there. Shot. That's good. And shot. I'm going to go down to the spine. Shot. Oh yeah. AP quick. Now we're going to switch the direction of the x-ray machine and get a front to back view. That first picture was a side to side. I'm a little bit off center. A little bit, about a few millimeters off. I'm going to reposition. Shot. Good. AP. We're using both front, back, and side to side x-ray views to make sure I'm in the middle at C5-6. Luis, am I at 5-6?
Oh, you are at 5-6.
That's perfect. Yeah, we're right there. Good. Lateral view. You can see between my fingers there's a spinous process of C5-C6. So I'm very happy with that. We're going to go into the disc space at this point. Shot. Yep. And get to the middle. Shot. And now we're going to do a discogram. You can see the needle sticking out of the neck. We're going to inject some dye, which stains the degenerated nucleus blue, the Deuk spine blue. Shot. All right, perfect. Look at that. All right, let's take a look at that for a moment. Stay there. And Jordan is going to show you the tear in the back of the disc. It's a pretty big tear right there. Show them that tear. Good. That's dye leaking out through the tear in the annulus. That's a posterior annular tear, and then the dye goes around the herniation. See the herniation there? Yep. So this is number 5-6. Let's count. 2, 3, 4, 5, 6. Everyone agrees? All right, good. So we're in the right place. We see the tear, we see the herniation. That's what we're here to fix. You are watching state-of-the-art spine surgery. This is the next generation, okay? If we were talking about the future of spine surgery today. If we were talking about military aircraft, these would be Generation 9 fighters, which don't even exist except in a few places. And that's what we've got here. This is the most advanced spine surgery in the world. It's endoscopic anterior transdiscal surgery, and that's why you won't find it done anywhere else. So if you want to watch it done, you have to watch it here at Deuk Spine. We're going to make a small incision. This is going to be a 4mm incision. 4mm is pretty tiny, just enough to get the dilator and the tube in. The tube that we do this surgery with is really only 4mm wide. So we don't need anything longer than a 4mm incision. I'll show you the knife. You see the knife here? It's called an 11 blade. That's what I use to make the incision. Now that we've made the incision, I'm going to take the needle out. Shot. I'm going to keep looking at the x-ray. I don't want to remove the guide wire. I just want to remove the needle. Shot. You got to be careful with the guide wire. You can accidentally push it in further, and you don't want to do that. Hold. Shot. So you want to keep getting pictures to make sure you don't take the guide wire out and that you don't push it in. And it's easy to accidentally pull it out because sometimes the guide wires get a little bent, and then when you're pulling the needle out, you'll pull the guide wire out. You can't do that. If you do it, you got to start over again. Shot. All right, so you can see the tip of the guide wire at the back of the disc at C5-6. Shot. And there's the dilator now coming down. Shot. You can see the dilator. It looks like a pencil. Luis, help me out.
Yes, sir.
Am I caught on the skin? Do I need to make the incision a little bigger? Or am I okay?
I think you're okay.
Shot? We're almost there. I feel like it's grabbing the skin. We may have to make another 0.5 millimeter shot. Now we're right in front of the spine. Let me see. Actually, we may be okay. Yeah, we may be okay. All right, good. That, for some reason, the lighting is casting shadows.
Can you,
Berndes, can you put the light here, please?
Sure. Thank you.
All right, there we go. Can you guys see this incision here, or where the tube's going in? You see that, Henry?
Yes, we see it.
All right. Good. Let's get an AP. I'm going to get my hands out of the way because I don't want to get them radiated any more than I need to. I am using a special type of glove. It's an X-ray proof glove. Perfect. So you can see the tip of the dilator is right where the spinous process is. Show them the spinous process. Stay on the X-ray, Henry. Show the
Copy.
audience the spinous process. There it is. Right there. Yep. Okay. So we're right in the middle. That's where the spinous process is. It's in the middle. We're going to get a lateral view. Shot. Now I'm going to be advancing. All those squiggly lines are the Raytec. I'm going to advance the dilator through the disc. As I do this, I'm not damaging the disc in any way. By the way, if you want to ask questions, feel free to do so. Okay? We take questions throughout the surgery. Shot. You can still see the tear. See it there? Shot. There we go. We're right inside the tear now. The dilator is now at the back of the disc where the herniation and tear are. And now I'm going to show you what we're going to do the whole surgery through is this tiny little tube right here. Can you guys see this tube?
Yep.
It's like a metal straw. Now let's show the audience, why do people get neck pain from a herniated disc? Let's show them how that works.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Now you've watched the video showing how an annular tear in the back of the annulus, called posterior wall. Posterior means back versus anterior, which is front. So a posterior annular tear is the first step in a herniated disc, and then once that's there, it's an area of weakness in the wall, and then the jelly from the center of the disc can push through there and cause a herniation. And it's really inflammation that causes all the pain. Our patient here has a single disc herniation, and all of her symptoms related to her herniation are due to inflammation. Some are due to compression. Now I get a question all the time, is the Deuk laser disc repair surgery FDA approved? The answer is yes. It's FDA compliant, meaning that everything we use here in terms of equipment, medication, supplies, is all FDA approved. Even the laser. All right, here we are at the back of the disc where the herniation is. We're going to get a pretty clear picture of what's going on here in a second. Luis, this scope is blurring a little bit. Let's grab that. Is this the one that was supposed to be sent back?
No, we sent it back already. The other one. So.
All right.
It's not the camera. It's not like a
No. It definitely gets worse when I put a little side bend on the scope. Let me see if I can focus it a little better. Yeah. But then as soon as Luis, look, as soon as I bend a little bit, actually, you know, you may be right. Yeah, there it is. See how it went out of focus a little bit? And then it's in and then out. This is the back of the disc where the herniation is. And I'm removing parts of the herniation right here. You can see the herniated disc is the blue stuff. This is not going to take too long, Dr. Berndes, I don't think. I think it's going to be a relatively quick one. And this is all relatively fresh. I think her symptoms started 2 years ago, right?
Yeah.
Certainly this is consistent. You can see the tear and the blue stuff there. The blue stuff is the herniated nucleus pulposus. I think we're going to need 15 minutes and then we'll be done. There's a piece of herniation right there. It just came out. This is the annular tear. There's a herniation right there. Beautiful. Now she's traveling, I know originally she's from Indianapolis. That's a nice little piece of herniation there. Just came out. Lives in Tampa now. They're smart to get out of Tampa and get off of the West Coast where the hurricane's coming, right? What is it called? Hurricane Ian, or what is it?
Ian, yeah.
Ian. I had a good friend in college named Ian. Is that right? Yeah. Ian. It's a nice name. Is that Germanic? Ian? Anybody know? What kind of name is Ian?
I think it's
Mexican?
Slovak, Czechoslovakian, Eastern Europe.
Puerto Rican?
Scottish Gaelic.
Eastern Europe.
Scottish Gaelic. Awesome. I'm just joking about Puerto Rican. I'm just trying to get Luis to laugh. It's not a Hispanic name. All right.
We have a couple comments.
Sure, we'd love the comments.
This first one is from Liz Lindsay on Facebook.
Liz, hi.
And they said, morning, praying for y'all's safety. Our daughter is in Seminole County. It's 8 miles southwest of Clearwater. They are a family of 8. They tried to leave, but traffic is at a standstill.
Oh, no.
They have the storm shutters. Yeah. Ugh, it's tough.
Well, your daughter will be in our prayers too, Liz. Thank you for mentioning it.
We do have another comment.
All right, let's hear it.
This comes from Shiraz on YouTube.
Hello, Shirax.
And Shiraz said, hi, I had a percutaneous discectomy back in 2019. I was good for almost a year, but now I am in pain again. I sent my MRI for review. I don't want a disc fusion. I hope I am a candidate.
Oh, you are a candidate for sure. Shiraz, let's put...
Shiraz.
Sorry. Let's put the phone number for Sam so that anybody that needs to reach Sam about their MRI review can do so. Sam is handling all the MRI reviews now. She's amazing. And she's a keeper. I don't think she's going anywhere, hopefully. You never know these days, though. People just come and go. But Sam is wonderful, and her phone number is 321-775-1299. 321-775-1299. So if you submit your MRI for a free MRI review and you don't hear back, just give Sam a call at that phone number. Of course, that's the United States number, and she will respond. I know she's trying to catch up to a lot of the MRI reviews that were submitted when Darcy was here, before Darcy walked off the job and left a lot of people high and dry. So anyway, go ahead and give Sam a call if you need to, and she'll help coordinate getting your MRI reviewed. But you know, I don't know exactly why you're having pain, but I can tell you whatever the reason is, we can fix it. There's only a few causes of pain in the neck. The disc is one, the facet joints are the other, and we can fix either cause. So unless you have an infection, which I don't think you're going to have, but it's certainly always possible. All right, we're removing pieces of herniation. There's lots of them. Every time I come out, I'm floating out another piece of herniation. There's another piece that just came out. Some of them are small, some of them are larger. I think we're a bit overexposed still. Can we turn the light intensity down? Problem is, when you turn the light intensity up too high, everything looks white. That looks good. That's that's pretty good. This is the annular tear right here where the laser is working, off to the right. We may be, oh, there's another herniation right there. Lots of pieces of herniation. And again, I'm just coming out and floating them out. They actually come out of the tube and float out onto the field. I think we went one click too dark. I would like to get just a little bit of light back. That's perfect. Thank you. All right. You have any more questions for us, Henry?
No current questions.
Well, let's show people what exactly we're doing with the Deuk laser disc repair. What is this laser business all about?
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, we're still at it. There's another piece of herniation. Lots and lots of pieces of herniation. And again, we talk about this quite a bit. We talk about how a herniated disc is just not one herniation. It's actually a collection of many in most patients. And just how many? Well, that's really up to the individual patient. But I'd say we typically see between 20 to 30, literally 20 to 30 pieces of herniation per patient, per disc. There's another piece right there. So all these fragments, these pieces, they used to be part of one big solid piece of disc. You know, the nucleus pulposus. The nucleus pulposus is one piece, and now it's broken up into lots of little pieces because of trauma. So whatever trauma this person had to their neck smashed the disc so hard and then pushed it out through the tear. And a lot of times the disc fragmentation into little pieces occurs at the same time that the tear occurs. You see the foramen where these pieces were coming out? It's now kind of empty down there. Still have a few more pieces to get out. There's another piece of herniation right there. Just so whenever the original traumatic injury occurs, you get a tear in the posterior wall of the disc, and then you also get a smashing of the nucleus, which is the cushion. There's a big herniation right there. Right in the foramen on her right. Most of her symptoms were left, but she was going to have right-sided symptoms very soon. You can tell. Look at that herniation coming out right there. Oh, baby. Love it. That's a fresher herniation. So I think she was really going to be having right-sided problems very soon, since all this is on the right side. But most of her symptoms are on the left. But that's the nerve down there, just below these pieces. I'll show you in a second. Thanks. The nerve is going to be down here, just up there, just there. And all this smashed stuff, these fragments are all just sitting there right on top of that nerve in the foramen. Now, this looks like it's a more recent injury, if you ask me. This has happened more recently. So maybe she just hasn't had time to get inflammation going from this injury. But it was destined to happen. Just a matter of time. Had some really good questions. Any more questions at this time?
No current questions.
Great. Well, let's show our audience, you know, if you're thinking about having a fusion done called an ACDF, let's show you why you shouldn't.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
All right, we're done. We took the tube out, and can you see the incision, folks? Can you see it, Henry?
I believe we can, yes.
It's right there. Here was the tube. That's the hole, literally right there. You guys see that? 4 millimeters, just big enough to fit the tube. Incredible, huh? No metal plate, no cages, no cadaver bones like everyone else is doing. Get your disc fixed naturally with the Deuk laser disc repair. All right, type up your questions. I'm going to answer them for you. I'll be there in about 5 minutes to do that. In the meantime, why don't we roll a little video for our audience? This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C5-C6, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. It is February 23rd, 2022, and I'm here with one of my patients who's traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much, much better. 26 years ago, I had a fusion of C6 and 7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March, and I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did
he did a
of Googling.
lot of research, and we found Dr. Deuk to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing, and that he really, really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be, because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the way
Yeah,
up.
just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, two of them, C4-5, C5-6, and the herniations were literally sitting on the nerve. And we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny, and here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. Well, most of the time it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Deuk will give you a free look-see on the MRI. It's well worth your time. And he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because you know, we got a little bit of a nest egg, and sure it's going to cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks, we'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake.
I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk Machen here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi, and he came here for the Deuk laser disc repair to be done for a herniated disc on his neck, and he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything's gone. A little soreness in my throat, my voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything, and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery. And I decided to give it a try, and I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused a adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and I'm here with one of my patients who just had the Deuk laser disc repair on her lower back, and she wants to share her story with you. Now, you came to Deuk Spine Institute because you were having back and left leg pain for how long?
The terrible left leg pain, probably about 2 years, but prior, I've had issues since I was 14 years old. So it's been a lot of roller coaster pain since then.
So you've had back pain since you were 14. You're clearly not 14 anymore.
No.
And so that's like 15, 20 years, right?
Yeah, too long.
And so why didn't you get it fixed sooner?
Well, the doctors when I was younger didn't want to operate. They wanted to, I was young. They didn't want to take a chance because all the surgeries then at that point, there was just nothing there that wasn't going to be traumatic to my back and my spine. So I went through physical therapy, shots, decompression. They did that, and nothing was really working. And then it eventually kind of got better, and then it would get worse, and it would get better, and it was just up and down, up and down.
Up and down. And the reason it got better was the inflammation from the injury to your disc started to get better.
Yeah.
But then you'd have another herniation with activity, and then it made it worse. So
Yeah.
when we were in there, and you can see from this video right here that we were pulling out lots of big fragments of disc herniation. You probably over your lifetime from 14 until now had at least 10, 20 different episodes of herniation, and that's what we saw when we were inside there.
Mm-hmm.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. The only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
Now, you're not from Florida.
No, I'm from Ohio.
So you travel Ohio to the Deuk Spine Institute in Florida. Why did you come all the way down to Florida?
There was nobody near us or anywhere near us that had any other option besides either getting a discectomy or a laminectomy or a fusion. There was just nobody was doing anything else. And I knew I didn't want to do that again because I'd already had that done. So it didn't work.
Didn't work.
I had a really amazing physical therapist that connected me with you, and the rest is history.
Yeah, your physical therapist found us and was intrigued with the surgeries we're doing here and sent you here.
Mm-hmm.
So what are you going to tell your physical therapist? I call him Dr. Salinas. What are you going to tell him when you...
Oh man, I've already told him. I texted him the minute I got back to our Airbnb. I said, I feel amazing, and I can't wait to tell all the rest of the patients in our Facebook group, this works. So
It does. The Deuk laser disc repair really does work. Well, is there anything else you want to say to your fans out there or friends?
my fans and my friends. Thank you for praying. Thank you for, believing me. I think that's one of the biggest things. There's a stigma around back pain because you can't see it, that people are just faking it, or maybe they're babies. Why can't you just deal with the pain? And it overwhelms you. And so to come someplace that believes me and then fixes the problem and now I'm sitting here and I can be like a fully active mom. So I'm just beyond thankful. Thank you.
Yeah, chronic pain robs people of their dignity and their happiness and joy in life, and also their loved ones, the people that care about them.
Yeah.
Because they suffer with you.
Yeah.
Yeah.
A lot.
Well, congratulations and praise God.
Yes.
You found us.
Thank you very much.
And I think you're going to do fantastic.
I'm looking forward to being strong again.
Awesome. All right. It's Dr. Ari Deuk at the Deuk Spine Institute here in Florida with one of my patients who had the Deuk laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well, thank
and I
you.
came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
Amen.
yeah, and I'm A1 now.
Awesome. So you had your surgery. You've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too. When you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
not too soon with any of that lifting engines.
all right, yeah, all right. But all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got, well, that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back. But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well, congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
You're
God
welcome,
bless.
sir. God bless you. Is this really what you want in your neck? Metal? Well, metal is going to cause your spine not to move. It makes it stiff. You take a normal moving spine and you fuse it, it stops moving. You lose that movement forever, the rest of your life. Take that metal with you to the grave. Now, if God wanted metal in your spine, He would have put it there to begin with. So why get metal put in and get a fusion when you don't need it? The surgery you just watched today is called the Deuk laser disc repair. It's the next evolution in spine surgery. It goes beyond artificial discs and fusions. As a matter of fact, it sheds the need for metal altogether. Why would you want to put something so unnatural in your spine as metal screws, rods, or metal plates? You don't. That's why endoscopic Deuk laser disc repair is the next advancement in spine surgery, where there is no metal, there's no cages, there's nothing unnatural put into your spine and left there. You have natural movement of your neck when you're done. The herniation is removed endoscopically, and the tear from which it came out of is debrided and cleaned so that it can heal properly. And that's what we just finished with the surgery. Surgery went very well. You saw that there were many pieces of herniation at the back of the C5-C6 disc. There was a large tear. It went from side to side, left to right foramen. There was large herniation pieces in both foramen, left and right. Our patient primarily had left arm symptoms, but it was just a matter of time before the right side started becoming a problem. There were a lot of herniated discs on the right side in the foramen pushing on the nerve. We got them all cleaned out. She's now recovering in the recovery room. She'll spend about an hour here and then be able to go home. Do we have any questions?
What kind of questions?
All right, well, I hope you enjoyed the surgery. The next one is a lumbar right approach, L45, L5S1. The next patient has lower back pain. It goes down into his right leg. We call that sciatica. He has spinal stenosis and a herniated disc with annular tear at L45 and L5S1. So we'll be repairing that